Hello there. Let's go through anatomy multiple choice questions on the histology of the pancreas. So question 1. What is the opening of the pancreatic duct into the duodenum? What is the opening of the pancreatic duct into the duodenum? A. Rogstowski-Akoff sinuses, and B. Ducts of Lakshka, C. Duct of Weisag, D. Ambula of Vater, and E. Sphincter of Oddi. So among these choices, what is the opening of the pancreatic duct into the duodenum? So on this diagram here, we see the pancreas and the gallbladder there. Now the cystic duct, which is the duct coming from the gallbladder, joins with the main duct of the pancreas, and they form what we call the ambula of Vater, which now opens into the duodenum. The sphincter, which controls the secretion of bile and pancreatic juice, is the sphincter of Oddi. And we have the duct of Lakshka. Now that duct is the duct which is an accessory duct which connects the cystic duct of the gallbladder to the liver somewhere there. And the duct of Weisag is simply the main duct of the pancreas. So what is the opening of the pancreatic duct into the duodenum? The correct answer is D, which is the ambula of Vater. The ambula of Vater is the one which opens into the duodenum there. So the correct answer for question 1 is A. We move on to question 2. Which of the following is the exocrine portion of the pancreas? A. Islets of Langerhans, B. Alpha cells, C. Beta cells, D. Delta cells, and E. acini. So which one among these is the exocrine portion of the pancreas? So here we have the acini cells of the pancreas, which are connected by the intercalated duct, which connects to the main pancreatic duct, which is the duct of Weisag. Now, the acini cells makes the exocrine portion of the pancreas, and these clusters of cells are called islets of Langerhans, which forms the endocrine portion of the pancreas, and they secrete their content in the capillaries there direct into the bloodstream. So the exocrine portion of the pancreas is what we call the acini. So the correct answer here is E. We move on to question 3. Which of the following clotting factors is not produced in the liver? A. Factor 1, B. Factor 2, C. Factor 4, D. Factor 9, E. Factor 10. So A. Factor 1 is fibrinogen, B. Factor 2 is prothrombin, and factor 4 is calcium. So calcium is not produced in the liver. So among all these, the one which is not produced in the liver is calcium, which is factor 4. So the correct answer is C. Question 4. In what structure does blood run through between the hepatocytes? In what structure does blood run through between the hepatocyte? A. Hepatic artery, B. Portal triad, C. Central vein, D. Portal vein, and E. Sinusoids. So the liver has a functional unit which is called a lobule. This lobule is a hexagonal shaped structure, as you can see here, and in its angles we have what we call portal triads. So these portal triads are formed by 3 vessels, which are the hepatic artery. We also have the portal vein and the bile duct there, and then they we have what we call the structure which runs from the portal triad to the central vein, and that structure is called the sinusoid. So that's where blood flows from the portal triad to the central vein, and it runs in between these cells, these brown in color cells, which are called hepatocytes. So the structure where blood runs through between the hepatocyte is called the sinusoid. The hepatic artery and the portal vein, they form what we call a portal triad there, and they drain into the sinusoid, which now drain into the central vein. So the correct answer is E, which is the structure where blood runs through between the hepatocyte. We move on to question 5. What is the space code that is located at the portal canal between the hepatocytes and connective tissue? A. Space of Disse. B. Space of Moore. C. Vacuum. D. Lacuna. And E. House-shaped lacuna. So the space of Disse is the space in between the layer of the sinusoid and the hepatocyte there. That space is called the space of Disse. And we have another space here, which is the space of Moore. That space is in between that thin layer of connective tissue and the hepatocyte. So that space is what we call the space of Moore. So the space that is located in the portal canal between the hepatocyte and the connective tissue is the space of Moore. So the correct answer here is B. The vacuum is simply a clear space in a small clear space in the cells of an animal cell, or even in the plant cell. We find what we call a vacuum. And a lacuna, this is simply a depression-like structure where chondrocytes are found, mostly in cartilages. That's where that space which is occupied by chondrocyte in the cartilages. There are cells which are called chondrocytes. Now they are in a space called lacuna, and in the bone they are called those spaces where the cells of the histiocytes are what we call the house-shaped lacuna. Okay, so the space which is located in the portal canal between the hepatocytes and the connective tissue is simply the space of Moore. So the correct answer is B. Move on to question 6. What layer is not found in the gallbladder? A. Mucosa. B. Muscularis mucosa. C. Muscularis. D. Adventitia. And E. Serosa. So the gallbladder, we are going to have about 3 layers. We have the innermost layer, which is called the mucosa, followed by the muscularis, which is made up of smooth muscle cells, and we also have the serosa, but we do not have the muscularis mucosa. So here, the layer which is not found in the gallbladder is the muscularis mucosa, but the mucosa is there, the muscularis is there, the adventitia is also called the serosa. So it's the same layer, but they are called interchangeably. So the muscularis mucosa is not found in the gallbladder. So we move on to question 7. What cell type make up the mucosa of the gallbladder? A. Simple squamous epithelium. B. Simple cuboidal epithelium. C. Simple columnar epithelium. And D. Stratified squamous epithelium. And E. Transitional epithelium. So epithelium is classified as covering and granular epithelium. So the covering epithelium is classified according to the shape of the nucleus and the cells, and also to the number of layers that epithelium has. So it is simple when it is made up of only one layer, and it is stratified if it has more than one layer. So a simple squamous epithelium, it is simply an epithelium where we have simple, which is it is made up of a single layer of cells, and squamous, that is the shape of the cells are flat. They are flat like these ones I've drawn here, and even the nucleus inside there, it is also flat. Now simple cuboidal, that is, it is made up of a single layer, and the cells are cuboidal, or the nucleus is in oval shaped. So we are going to have cells which are in cube-like shape, and then this nucleus is oval shaped inside there. Then we have simple columnar, that is, it is made up of a single layer, and the cells are columnar, or the nucleus is elongated. They are columnar cells. Then stratified squamous, that it is stratified, it has more than one layer, and the squamous, that is, it is made up of flat cells like those ones there. Stratified, it is made up of more than one layer. Transitional epithelium, it is in between cuboidal and columnar. So the type of layer, or the cell type that makes up the mucosa of the gallbladder are the simple columnar epithelium. We are going to find simple columnar epithelium in the gallbladder. So the correct answer is C. Question 8. What is the classification of the pancreas? A. Mixed. B. Endocrine. C. Exocrine. D. Both endocrine and exocrine. And E. We have none of the above. So classification of the pancreas, we say the pancreas has both endocrine and exocrine. So the correct answer for question 8 is D. We have the endocrine part, which is the islet of Langerhans, and we have the acini, which is the exocrine part. So it is classified as both endocrine and exocrine. So the correct answer is D for question 8. Question 9. Which cell is a hepatic macrophage? Which cell is a hepatic macrophage? A. Kupffer cells. B. Histiocyte. D. Dust cells. C. Dust cell. D. Langerhans cell. And E. We have the microglia. So here, which one among these cells are hepatic macrophages? So the Kupffer cells are hepatic macrophages. They are found in the liver lobules. In the lining of the sinusoid, we find the Kupffer cells, which engulfs bacteria and other foreign materials in the liver. The histiocytes are found in the connective tissue. The connective tissue, we find what we call histiocytes. Those are all macrophages, but they are named according to the area where they are found. So the Kupffer cells in the liver, histiocytes in the connective tissue, dust cells in the respiratory tract, on the airways, we find what we call dust cells. And then the Langerhans are in the skin, and the microglia are found in the neurons. On the nervous system, we find the microglia. But in the hepatic macrophages are found in the liver. So the correct answer is the Kupffer cells are hepatic macrophages. Move on to question 10. So question 10 reads, where in the pancreas are islets of Langerhans most numerous? A. Head. B. Body. C. Tail. And D. Even distributed. E. Depends on the individual. So where in the pancreas are islets of Langerhans most numerous? So the pancreas is divided into 5. We have the acina. This one is the acinate, and then we have the head here. This is the head, and we have the neck. We have the body, and the tail. So among all these regions, where are the eyelids of Langerhans most numerous? So they are numerous in the tail. So in the tail, that's where you find eyelids of Langerhans. They are more numerous in the tail. So the correct answer is C. So thank you very much for watching this video. Don't forget to like, subscribe so that you don't miss any of my videos, and leave your comment concerning this video in the comment section below.